I'm Dr. James Boler. I'm an orthopedic hand surgeon. I've been practicing at Ellis Medicine for the last 11 years. I see patients of all ages. Most of my patients are patients with problems with their hands or wrists. I see a lot of wrist fractures, a lot of finger fractures. I see patients with carpal tunnel syndrome, patients with thumb arthritis, patients with tendon lacerations. Those are the patients I see most often. I studied biomedical engineering in college, and I found that orthopedic surgery matched very well with that when I was in medical school and decided to do a residency in orthopedic surgery. After that residency, I did a hand surgery fellowship. Again, I found that the biomedical engineering training was applicable to hand surgery, and since I've been in orthopedics and hand surgery, I really enjoy taking care of patients and getting their hands and wrists back to functional status. During an appointment, I like to interview the patient and get an idea of exactly what's been bothering them. Again, most of my patients are hand and wrist patients, so they use their hands for everyday activities. They're having problems doing their activities of daily living. I try to get an understanding of exactly what is bothering them and how I can help them get back to their activities and their passions, the things that they love to do, but are not able to do because of pain or arthritis or a fracture or something like that. I like to treat patients as if they were my friends or family. I like to try to pinpoint exactly what is bothering them and formulate a treatment plan in order to improve their function. Outside of work, I like to spend time with my wife and children. I have 4 school-aged children. I really love to watch them play sports, especially basketball and lacrosse. I'm also involved with the Schenectady County Medical Society. I'm the president-elect of the County Medical Society. We advocate for patients and physicians with our legislatures in Albany. The surgeries that I perform the most would most likely be endoscopic carpal tunnel releases, patients with wrist fractures that need surgical treatment, and arthritis surgery for people with arthritis at the base of their thumb. I see a lot of patients with carpal tunnel syndrome. I like to treat this most often with the endoscopic technique. It's a minimally invasive technique. Instead of making an incision in the palm here, I make a small incision here, and I'm able to use an instrument like this with a scope. I put the instrument inside the carpal tunnel under the skin, and I'm able to activate the blade and cut the ligament from the inside. That way we just have a small incision here with a single stitch, and patients are able to use their hands quickly after surgery. I operate on patients of all ages, from approximately 2 years old, children, through childhood and adults and senior citizens.